Today our class is on white blood cells. White blood cells are also known as leukocytes, and they are colorless and nucleated formed elements in the blood. In comparison with red blood cells, they are larger in size, they are lesser in number, they have irregular shapes, they have various types, they are nucleated, and their lifespan is shorter. White blood cells can be classified based on presence of granules or not into granulocytes and agranulocytes. Examples of granulocytes are neutrophils, eosinophils, and basophils, while examples of agranulocytes are monocytes and lymphocytes. Lymphocytes, which are types of agranulocytes, can be further classified based on size and function into large and small, and T lymphocytes or B lymphocytes. Neutrophils have lifespan of 2 to 5 days. Eosinophils have lifespan of 7 to 12 days. Basophils have lifespan of 12 to 15 days. Monocytes have lifespan of 2 to 5 days, while lymphocytes have lifespan of half to 1 day. Variations in white blood cells. Leukocytosis is the term used to describe increase in total white blood cells. Leukopenia is the term used to describe decrease in total white blood cells. Granulocytosis refers to increase in number of granulocytes. Granulocytopenia refers to decrease in total granulocytes. Agranulocytosis refers to absolute lack of agranulocytes. Functions of white blood cells. They protect the body from invading organisms and foreign bodies.